These 7 life-saving tips to survive a heart attack alone. It could save your life. Picture this. You're at home alone or out running errands, and suddenly, a wave of chest pain takes you by surprise. There's no one around to help, and time feels like it's slipping away fast. A heart attack is one of the most urgent and dangerous medical emergencies you could face, but knowing what to do in this critical moment can mean the difference between survival and tragedy. In this video, we'll guide you through 7 life-saving tips that can help you survive a heart attack when you're alone. These steps are simple but absolutely critical. By acting swiftly and correctly, you can take control of the situation and increase your chances of staying alive until professional help reaches you. Let's dive straight into it because when it comes to heart attacks, every second counts. The first and most important step is recognizing that you're having a heart attack. Many people ignore the initial symptoms because they mistake them for something less serious, like indigestion or fatigue. Here's what you need to look out for. Common symptoms. Heart attacks usually manifest as intense chest pain or a feeling of tightness, squeezing, or pressure in the chest. This pain might radiate to your arms, jaw, neck, back, or stomach. You could also feel dizziness, nausea, shortness of breath, or cold sweats. Less obvious signs. Did you know some heart attacks are silent? This means the symptoms are subtle, such as feeling unusually tired, nauseous, or lightheaded. Sometimes, the only warning is mild discomfort or a sense that something isn't right. The moment you recognize these signs, don't wait for them to go away or convince yourself it's nothing serious. Acting in those early moments could save your life. When you realize you might be having a heart attack, staying calm may feel impossible. The fear and physical discomfort can overwhelm you, but staying calm is critical. Why it matters. Panic can make things worse by increasing your heart rate and blood pressure. This increases the workload on your heart, which is already struggling. Calmness helps you make clear decisions and keep your body as stable as possible. How to stay calm. Slow, deliberate breathing can help. Inhale deeply through your nose for 4 seconds, hold your breath for 4 seconds, and then exhale slowly for 6 seconds. Focus on this rhythm while you take the next steps. Remember, the calmer you are, the more effective your actions will be. The next step is possibly the most important one, grabbing your phone and calling emergency services right away. Why time is critical. The sooner professionals arrive to treat you, the better your chances of survival. Heart attacks cause damage quickly, and every minute counts when it comes to saving heart tissue. What to say? When you reach the dispatcher, stay as calm as possible and describe your situation clearly. Share your location, describe your symptoms, and let them know if you have any heart-related medical history. Don't drive yourself. This is crucial. Driving while having a heart attack is extremely dangerous. You could lose consciousness or worsen the stress on your heart. Wait for paramedics, who are trained to stabilize you while en route to the hospital. Making this call early and communicating clearly could become your lifeline. You might not realize this, but the way you position your body during a heart attack can help reduce strain on your heart and improve blood flow. What to do? If you're sitting, remain seated and try to lean back slightly while propping your upper body up. If you're lying down, raise your head and shoulders with pillows or anything within reach. Avoid lying flat on your back, as this can make it harder for your heart to do its job. Avoid physical exertion. Do not attempt to walk, move around, or exert yourself in any way. Your heart is already under extreme pressure, and overexertion could make the damage worse. Think of this position as giving your heart the best chance to function during these moments. If you have access to aspirin, this simple step could make a huge difference in saving your life. Why aspirin helps? Aspirin works as a blood thinner, which can help prevent blood clots from worsening and blocking blood flow to the heart. It's especially effective when taken during the early stages of a heart attack. How to take it? Chew 1 full-strength tablet, 325 milligrams, of aspirin or 2 baby aspirins, 81 milligrams each. Chewing the aspirin allows it to enter your bloodstream faster than swallowing. Safety precautions. Make sure you've never been told not to take aspirin by a doctor. If you're allergic or on a blood thinner, skip this step. This tiny pill can buy you precious time until medical help arrives. However, only take it if you're sure you're having heart attack symptoms. Once you've called for help, positioned yourself properly, and taken aspirin if possible, the next step is to manage your breathing carefully. Why this works? Slow, controlled breathing lowers your body's oxygen demand, reduces strain on your heart, and helps calm your nervous system. How to do it? Use the same breathing technique we mentioned earlier. Focus on breathing deeply, slowly, and steadily. If you become short of breath, try to lengthen your exhalations rather than your inhalations to maintain calmness. Think of this step as buying your heart a little more time by keeping your system as stable as you can. While waiting for the ambulance, there are a few practical steps you can take to help paramedics when they arrive. Prepare your space. If possible, unlock your front door so responders can enter quickly. Move any obstacles out of the way to ensure they have a clear path to reach and assist you. What to keep nearby: collect your ID, any medications you're taking, and any medical records or health card information you might need. Emergency responders will need this information to provide the right care quickly. These small steps make it easier for responders to begin treatment without delay. Facing a heart attack is terrifying, but here's a thought. What if you could minimize your risk by staying prepared and knowing your health status? Know your risk factors: family history, high blood pressure, obesity, smoking, and high cholesterol are all factors that increase your heart attack risk. Speak with your doctor about your personal risk. Get regular checkups. Routine medical visits can catch potential problems early, giving you the chance to take preventive measures like medication or lifestyle changes. Carry an emergency kit. Keep aspirin tablets, emergency contacts, and your medical information in an easily accessible place at home or in your bag. Preparation gives you peace of mind and increases your readiness for any surprises. It's easy to feel helpless when you think about the possibility of having a heart attack while alone. However, learning these life-saving tips not only equips you with practical tools, but also builds confidence. Building confidence. Remind yourself that preparation is power. The knowledge you've gained today could make all the difference in an emergency. Share what you've learned. Don't keep this information to yourself. Share it with family, friends, and loved ones. Whatever you learn today might save someone else tomorrow. Remember, fear is natural, but preparation always wins. Let's recap the 7 steps one last time. Recognize early heart attack symptoms, stay calm, call for help, position your body correctly, take aspirin if available, focus on calming your breathing, and prepare for emergency responders. These actions are not complicated, but they are life-saving. In moments when every second matters, knowing what to do can make all the difference. Before you go, take a moment to reflect on how valuable this knowledge could be, not just for yourself but for others around you. Watch this video again if you need to, share it with someone you care about, and make it a point to stay informed about heart health. When it comes to a heart attack, preparation is your greatest ally. Remember, when seconds count, so does your knowledge. Stay safe,